We need to have, I'd like to have it here, because I really do think that the state, when they required us to carry health care the way they did, is ignoring the fact that you're carrying people whose health care costs you are not allowed, basically, to charge them, and it creates a larger deficit for you.
But then going forward, then, if you look at the actuarial tables, then, and if you leverage this based on what we know now, I mean, that's 100% increase. That's a $9 million increase.
You got more people, the main reason is because you have so many more people that are retired that we're carrying, that's it.
And it's going to increase. These are the type of things we need to flag for the future in discussions, whether it's union discussions, it's everything. This cannot go undiscussed. This is huge. This will be the Titanic if we're not up on it.
Well,
this will be it.
What I think your real emphasis should be, is you see this, I don't even think the state understood the magnitude of how this can climb as a liability against us. Because, you know, on one hand, you're allowing people to retire early. On the other hand, you're requiring us to carry them, and to carry them at a cost that doesn't handle their costs. And, you know, I'm not sure that, we're not alone in this, and I'm wondering whether maybe there ought to be some feedback back to the state, because I'm not sure they understand what's going on as more and more people retire. It's going to be a good discussion. She's right,
It'll
we
be
need
a
a
discussion. It'll rank right up there with BJJ, and then.
Yes. Unfortunately, I don't think we'll do much better either in terms of the state.
That's my point. But for us, we're the ones, these are our numbers.
Yes,
These
yes.
are our employees.
Yes.
This is what we're responsible for. And we need to keep this, we just need to keep this in
Right.
the forefront and understand. I don't want to be here a year, 2 years, 3 years from now, or by the time Mr. Patterson's termed out in 6 years going, how in the world are we going to pay for liability for our retirees? Because
I'll be 72 years old then.
yeah, and
Well, we won't have to carry you.
it's just an important issue in this whole
It's
discussion.
it's very important,
So
because
then-
it was never as big a number as it is now.
Okay, so let's say in this process, we do it out, go out to RFPs, you know, we're self-funded now. Let's say we get a bid in from a private insurer, and it's something council wants to genuinely look at. Let's say that happens. How does that impact the OPEB liabilities? Do we keep the reserves from this account to pay for that? I mean, how does this get funded?
They figured in their cost.
Good morning. Let me, if I may make a couple of comments. I'm Donna Heisler, Deputy Director of Finance. Couple things. First of all, whether you're self-insured or whether you buy or pay a premium for a product, you still have to show an OPEB liability regardless. So that doesn't really go away.
That's not what I'm asking. How do we fund it?
How do we fund it? Well, let's talk about that for just a moment. If you look on the third question that came over, they wanted to know what were the premiums that are paid by the retirees versus the cost that we pay out in claims for the retirees. Right now, retirees in general are running about $2 million a year. In other words, we're paying $2 million more a year in claims than we are receiving premium payments by those individuals. So what we're doing is we're funding that $2 million towards that $19 million liability. The problem with the standard, and which has been a problem for practitioners as well, we're showing this $19 million liability. But what we're doing is we're actually funding $2 million of that every year to cover those claims costs each year, and that's taken into account. This $19 million is looking at me, Donna DePreister, as an active employee, and all the active employees, going through a series of calculations determining, well, of the active employees, how many of those people will eventually retire and stay in the plan. And then you've got this large liability that's being projected out over 30 years.
I understand
So
that.
we're funding pay-as-you-go based upon the actual claims that we're paying over and above the premiums coming in. And that's the funding of that liability currently, the way that we're handling it.
I'm not talking currently. I will talk,
Okay.
that was not my question. I will take this at another time when I get it, take it at a different
All right.
level.
let me see if I can give another example that may help, and then I'll answer the questions on it. But let's say that the fully insured rate comes back at $600 an employee. That's the fully insured rate. That's a rate that blends all of the claims together of the retirees and the active employees that we had talked about before. When you separate out those retirees, let's say their cost is $1,000. You're still paying $600. That's what the premium is. That delta of the $400 is what makes up that issue of the liability, and that's what is that piece over time that becomes that unfunded liability.
We'll have a separate
It's a state-
discussion on the issue.
Yeah, it's a state issue. It's not something you have control of.
I know, but it's something I honestly believe that when the state did that, because the number was small at one time, I don't think they understood the implications as the workforce gets older. And I think that's one of the reasons that she's bringing this up. The workforce is getting older. These people are retiring. You're getting more and more retiring. And so this liability grows, and it's not something we can deal with because they make us do this if you're gonna have a plan. And I honestly believe, it's one of those things that maybe you start talking to the state legislature about. I don't think they understood the long-term implications as the workforce gets older. And so it may be, we do lobby for things. There are things that maybe we ought to look at because I think this creates a larger liability for communities. Somebody's got to pay. Thank you.
All right, Mr. Patterson.
I'm glad I'm getting a chance here.
You're not turned out yet.
I think I know Mr. Roberts is here, we go back a few years, and actually, two former school teachers who got into the insurance business, but he got into it in a different way than I did. I just sell the stuff, and he just analyzes the heck out of it. But it is, I've worked with Mr. Roberts in the past, and I will tell you, it's good to know that we've got him on our team, working with us on this. And he didn't even pay me to say this either.
Thank you.
The thing I've noticed about, because, 38 years in the insurance business, and I started out selling just about everything, life, health, disability, and that, and then it got so complicated, especially health insurance has gotten tremendously complicated over the years. And just all of the changes, and we look at our dependents, our first responders, because they're with that defined benefit plan, but they get a little bit better of a retirement than the others. And I know that many of our retirees that are not first responders have to go get another job to pay for the health insurance. That's a critical element. Even after 30 years of working for the county or working for the state or whatever, they're finding that they really have to go out. Health insurance becomes really critical to them. And you look at also, the changes. Suddenly now we're covering 26 children of dependents up to age 26. That's something, a factor in there that we really don't see. And in many cases, that 25-year-old person's not even living at home. He's off someplace else, still being covered because of the changes in law. So it's really gotten complicated. And there's a lot of errors and omissions, exposure that insurance agents have and that. So one thing I get tired of listening to people talking about the Cadillac plan that the county has, and it's so much better, and that's why it's so expensive. And seeing some of the numbers here, it indicates that we're pretty much along the same lines as everybody else around here. And for us to be going out and not only looking at a self-insured plan, but also other type of plans, we can get a good feeling for that we're headed in the right direction. And the so-called theory of Cadillac plan policy here in the county doesn't really apply. Mr. Johnson, thank you very much for, I know it's a lot of information for council members. I think Deb and I, because of our experience in the insurance business over the years, can be a lot more technical in our questions. So, but
It was so long ago he taught my, it was so long ago he taught my insurance class, just so you know.
Oh, my God.
Yeah, she was just Were you blind then?
Long time ago.
And just to add, we have a number of people that support us at Robinson Bush. I have actuaries and that help with the underwriting, and I have one of our members has a master's degree in health plan informatics, and we have a number of different CEBS. So we have a number of people the team that we put together is one that helps support all the things that we're talking about. So thank you for the.
Yeah, well, it's incredibly complex, and you can, with these self-funded plans, you can pretty much tailor make them any way you want. But then it gets down to, how much do you value your employees that are working for you?
Mr. Deneen.
One final comment, in case of Mr. Robinson, I appreciate the comment, Mr. Patterson. Mr. Robinson, one of the hardest things about doing this, I am comfortable, first of all, I think we need to do a complete analysis with all hands off, saying we'll look at everything. But I'm comfortable doing that because we have him on board, because it's hard to find somebody with Ms. Robinson's qualifications who is a neutral working for us. And that is so, a lot of places don't do this analysis, because I can tell you right now, I have very sophisticated staff. I've been dealing with a lot of these issues all my career. I don't know enough to make the choice, the comparison that he can make between apples and apples when these bids come in, because they will complicate these, sometimes on purpose. But the point is that you really need somebody to go through them for the sake of your employees and for the sake of what you pay, and really make sure that you're comparing apples to apples. That's his job. The beauty of this is, he works for us. He's not selling us a product, okay? So we can abuse him, we can use him as well as we do any employee. And so any questions we have, I really encourage the council to take. This is very complicated. The nice thing is, we're doing it early enough, so we're not rushed. Because you do not want to rush into this decision. But I worried until we hired Mr. Robinson about our ability to be able to compare plans. And now I feel very comfortable. I think Mr. Patterson appreciates that. This is difficult to do, and you need a neutral like him to do it.
Well, and I can verify to their integrity. They're not, they're not getting a commission. They're basically working for us. You can go out and hire an agent to go out, work on commission. There's nothing wrong with it. But in this case, it's the amount of premium is so large, and the amount of responsibility is tremendous. So to have them working for us is good.
And some of the things he's done alone with his firm, they've saved us millions of dollars in some things he's done already.
Okay, well, thank you very much. We're all done with that. We'll continue on with our next.
More to come.
Thank you. Yeah, you are not kidding. There's one other thing about this healthcare discussion that doesn't is, and you really got to pay attention to these numbers, especially when you talk. You are a fast talker. Next time, try decaf.
I understood every word.
Well, I understood every word. It's just that you really got to concentrate. Were you ever an auctioneer in your previous life? You are one. Even when we had our little meeting before this,
Right.
you talk very quickly. So, and you try to keep up with it.
Thank you.
Thanks, John. All right.